they're getting set up, I'll introduce us a little bit. So like she said, my name is Joanna Behm. I'm an occupational therapist from Pennsylvania. I work part-time in an inpatient rehab facility a couple days a month. I also teach at Messiah College in their Master's Occupational Therapy program, and I am a patient with Dysautonomia, mast cell, and EDS. So that's been fun. With me today, I also have two students that are part of a research group where we are going to study the quality of life of patients with dysautonomia and how OT can intervene. So we have Katie Galarski here and Josh Yarn there. He's going to help us with the slides while we're going through. All right, I guess we'll get started. So what we're really going to be looking at today is occupational therapy's role in managing fatigue. We're going to talk about what occupational therapy is, because if I asked all of you right now, would you guys know right away? Would you be able to explain it? Anyone? No.
ADLs?
Yes, ADLs, yeah. Anyone else? Occupation. Energy conservation, yep. Great. So, go ahead.
Daily functioning?
Yeah, daily functioning, yeah. So a lot of my patients now will say things like, oh, you're the toileting people, right? And I'll say, I mean, we'll take you to the toilet, sure, but that's not like exactly what we do. A lot of patients will also say to me, well, I don't need a job. And I'll say, that's great. I don't need to get you a job. Occupation is a lot more broad than a job. So we'll get into that. So I want you to leave today understanding what occupational therapy is. I want you to understand the role that OT can play in managing fatigue. Who in here has fatigue? Right, yes, almost all of us. And fatigue is not tiredness, right? Very different. So we want to make sure that you understand what OT's role is in treating that. And then we're going to talk about just some techniques that you can use to decrease your fatigue. On your tables, there's actually a handout that the students made, that Josh and Katie made, which is awesome. So please take one. It just has some points of things we're going to be talking about today. All right, go ahead, Josh. All right, so what is occupational therapy? So I told you we're not the toilet people. We don't necessarily help you get a job, because the population I work with, I think the youngest person is probably 70, so I do not help them get a job. What we do is our goal is to help our patients do what they want to do in daily life. So that can be really anything. So sometimes it is bathing, right? Sometimes it is getting a job, but lots of times it's going to be a whole variety of other activities. And we do this through activity. So we use activity as our mode of intervention lots of times. So I'll give you some more examples in a minute. Go ahead. So occupation is anything that you find meaningful. So ADLs are activities of daily living. Those are going to be things like bathing, dressing, toileting, eating, all of that, grooming. Our instrumental activities of daily living, or IADLs, are going to be things like taking care of your pet, going shopping, paying the bills. They're higher level activities that are a little harder than maybe some of our self-care activities. Education, so going to school, maybe doing online education, having kids engage at recess, right? All of that's included in their education. Work, which we talked about. Play, leisure, and social participation. So I don't know about you, but when I feel really sick and I'm really fatigued, the last thing I want to do is go talk to someone. I don't know about you, but I just want to lay on my sofa, which is totally okay. It's okay to do that. But how can we help our patients be able to meet their emotional needs as well, which includes social interaction and fun and leisure? So we're going to talk about that. So the way that we help our patients engage in things that are meaningful and important to them are through a variety of approaches. So we want to promote and maintain health, right? So the health that you already have, the things that you're already good at, we want to help you stay good at them. Reducing or correcting impairment, this is what we call remediation. So if there's a problem, we want to help you fix it. So an example could be, something as simple as, I'm really weak because I've been laying in bed for 2 weeks because I had the flu. Has that happened to anybody? Yes, not fun. So we need to help you build back up your strength and your endurance, right? We're going to fix that. The next is adaptation. So this is kind of, I sort of picture it as the opposite approach. So I'm not fixing, I'm adapting. So instead of trying to change, the way you're doing, instead of trying to make better the way you do something, we're going to change either the activity or the way you do it. So we're going to teach you different ways to do things. We also want to help prevent disability. So how do we help people not get worse, right? Sometimes we just want to maintain where we're at and we don't want to get worse. That's something that OT is an approach OT can take as well. And then the last is education. And you know, as patients ourselves, we need to make sure that we are really educated on our conditions, and because I don't know about you, but the majority of my providers don't know a lot about my conditions, so I have to educate them lots of times, right? So occupational therapy can help empower you and make sure that you're well educated to be able to advocate for yourself, which is really important.
That's great.
That's my favorite OT picture. I really want a shirt with that. I don't have one yet. Do you? That's fantastic. Great. I love that. Yes. So that's our T-Rex. It's kind of like our little, like, what do I want to call it? Character, sort of. He has the short arms, but don't worry, he can still reach things because we give him reachers. So what can OT do for fatigue, right? So we know that fatigue is not tiredness. Fatigue, in the way that I describe it, in the way that I feel it, it is overwhelming exhaustion, right? It's going to impact the way you think. When I'm really tired, I can't articulate myself well. I have lots of brain fog. When I'm tired, I have aches. My body hurts lots of times. I feel like I just have all this weight on top of my body. So we want to make sure that our providers understand what fatigue is and really make sure that they can help address that. So we are experts at what we call activity analysis. So activity analysis, our students can attest, they just took this class last semester, and they had to analyze an activity all the way down to every single little minute detail, and their sheet that they have to fill out is 13 pages. So they have to analyze washing your hands so intensely that it takes 13 pages to do so. That is what occupational therapy does. It was not fun, no. But in real life, I don't do it on 13 pages, I do it in my head, right? But in school, you have to learn, so we write it out. So we are analyzing an activity from every single level you could think of. We're looking at it from a biomechanical standpoint, so from the physical standpoint. We're looking at it from a social standpoint, from an emotional standpoint. We're looking at it for how heavy it is. What skills do your joints need? What skills does your cardiovascular system need? We're looking at the whole entire body. So because we're experts at that, we can figure out ways to change activities or ways to change you, in a sense, to help you be able to do what you want to do. So because we're experts at activity analysis, we're then experts at energy conservation. And everyone's heard this, right? You go to the doctor, you say, I'm really tired, and they're like, you should sit down. Great. Fantastic. Yeah, sitting down's good, but there's a lot more we need to do than sitting down. I don't know about you, but if I sit down, I'm not magically better, right? If only, right? So energy conservation is really important, and we're going to talk about all these throughout our presentation. Can you go back, Josh? I'm sorry. We're also going to talk about environmental modifications and activity modifications. So how can we change your environment to make your environment suit you better? Does anyone have their bathroom on the second floor? So when you're really tired, do you really want to walk up a whole flight of stairs to go to the bathroom? That's hard, right? So how can we adapt our physical environment so that we make our lives a little bit easier? We're also going to talk a little bit about health management strategies, and then OT is really great about educating on safe exercise. So we're all told, and this is my favorite, when I go to the doctor, I'm like, I'm so fatigued. They're like, you should exercise more. Great. But like, did you think about the fact that I just said I'm really fatigued? Like, I'm exhausted. I'm not going to go exercise because I'm exhausted. So we need to address the exhaustion so that we can then go exercise, right? Because we know exercise is vital to our well-being. But I cannot exercise if I cannot get off the sofa. So we need to get us off the sofa first. Go ahead. All right, so I'm going to turn over to Katie to talk a little bit about energy conservation.
Okay, so energy conservation or work simplification is when activities are changed to minimize fatigue, joint, and muscle pain by remaining independent and less frustrated as possible. So we have 4 Ps that kind of sum up the energy conservation, and the first one is plan. So when you think about planning, you think about looking at your whole week as a whole and then breaking it down by day. What you're going to do at the start of your day and when you're going to cap yourself off. Then you have prioritizing, and prioritizing is basically just you think about what must get done for that week, and that's really important. And then you look at what could get done, but doesn't matter. Then you decide, okay, what do I need to do that It's myself. I know I need to get this done. What can I do with the help of somebody, and what can I delegate to other people? Like having your son do the chores or having your husband drive to the grocery store. Then you have pacing. And pacing is extremely important because we need to take our time. We need to have frequent rest breaks in order to not expend so much energy. And then you need to position yourself. And positioning is a big deal. I don't know how many times I go and throw myself on the couch and I have to reposition, and that takes more effort than if I backed up, put my hands down, and actually sat back down on the couch. Or if I go and bend with my back instead of at my knees to lift something. I'm using more energy by just bending over instead of actually taking and breaking down those steps. Go back. So this picture right here just kind of represents the effects of fatigue without any of these interventions. So in the blue you can kind of see like I don't want to be bothered. It kind of gives like a negative annotation to things, but in the yellow, it's really faded. It's more of like a positive aspect, and this is with the use of energy conservation. You seem to have more energy for things that are important, you can tolerate more, and that's more positive aspects of this intervention. So just some examples for plan and prioritize. So again, just reiterating for your plan period, of course you want to plan for the whole week and then break things down by day and what you're going to do during the day, but you want to plan to alternate heavy and light tasks. So do a heavy task, then do a light one. Or plan your week out ahead of time. So making sure that if you have several errands to run or you have something really hard that week, you know that you're going to like alternate things accordingly. And then for prioritize, you're going to prioritize your rest, your leisure, and getting enough sleep each night. Sleep is really important. That definitely fuels your body, so that's important. And then again, just reiterating that point, decide what you must do for the week and then what could be done. Okay. And then for pace and position, again, you never want to rush yourself. You want to give yourself plenty of time to accomplish a task. Even if you plan way out ahead, that's totally fine. Like this morning, I got out of bed at like 7:45 and I was ready way before I needed to leave. But that's okay because I could get a coffee and enjoy the traffic. So just thinking about that, like planning ahead, that's extremely important. And then for positioning, again, avoiding bending and reaching too much, and make sure you can sit. I know this is hounded a lot. Sit as much as possible, but actually that reduces the amount of energy that you expend, so that's extremely important. And then use both hands when lifting objects, wheel things around. You're just trying to make your environment a little bit more easier for you so that you don't feel as tired at the end of the day.
So there are lots of ways to use energy conservation. If you have an occupational therapist, they're going to find the ones that work specifically for you. So we just gave you some broad ideas, but you need to sort of figure out what works for you. The literature talks about planning an entire week out. I personally can do like 2 days at a time. Like that's sort of just what I can do, and that's okay. So I know that after today, I'm going to be exhausted. So tomorrow, I'm not going to do much. So I did the chores on Friday so that I didn't have to do them on Sunday. So I just kind of plan several days in advance just to kind of protect my body. And one other thing I wanted to mention that's just really important about that is I find that people who don't necessarily know how it feels to feel fatigue will say things like, well, you just need to like plan your day better, you need to rest. Problem is, I don't know I'm tired until I'm tired. Like I don't know in the moment that I'm doing too much lots of times. So sometimes even doing an activity log can be really helpful. So what I had to do in the past is really figure out what makes me tired, because at the end of the day I'm exhausted, but I don't know what activity it was that made me exhausted. Do you know what I mean? So that's just some other things to think about. With environmental modifications, I'm just giving some ideas here, but there are lots of ways that we want to modify our environment to make sure that it fits us as best we can. So I realize that not everyone can go in and break down their walls and build a bathroom on their first floor and widen all their doorways, right? Like that's probably not reasonable for everybody. So that's why I sort of broke this up as simple things and then more complex things. How many people in here use grab bars in their shower? Does anyone have grab bars in their shower? They're awesome, right? Grab bars are fantastic. I mean, I don't have one, but if I should. So I'm a hypocrite, I'm just gonna say it right now. But grab bars are really important because they're gonna help us reduce fall risk, right? And if I fall, I'm going to get hurt. And if I get hurt, I'm gonna be more fatigued, right? Or I'm gonna be laid up in bed, and then my energy is going to go down because my endurance will go down. So we wanna make sure that we're really engaging in safe practices. Does anyone have a bed grab rail? So there are, is there a hand? Awesome. So there is, we call them bed canes. It's literally like a rail that goes right beside your bed, and then it anchors underneath your mattress. And it's something so that when you roll, you actually have something stable to hold on to, and you're not like pushing up on your elbows and your wrists and putting a lot of pressure on those joints. So that's a nice, easy, home modification thing you can do that's not very expensive. We want to rearrange our objects based on frequency of use. So if I were good at cooking, which my husband can attest I am not, I would have the cooking supplies that I use more frequently maybe out already on the counter or in a cabinet that I can reach more easily. So for example, I eat the same thing every morning, I have the same cereal, same peanut butter, so I have them in cabinets that I don't really have to bend too far in, and they're right there for me. So I'm going to rearrange my living space in a way that everything that I frequently use, I have easy access to. Decluttering is also really important because it takes a lot of energy to go through clutter. So decluttering is vital. Placing objects in sequence of use. So I really do have my bathroom kind of laid out underneath my cabinets of like what I use first, just so I can kind of go through, my morning routine more easily. And then consider putting all the items that you use frequently on the first floor. So these are things even like if you need a walker, have a walker upstairs and downstairs. So that way you don't have to carry the walker upstairs. It's just little things like that. So energy conservation, the whole point is that we want to save little pieces of energy throughout the day, which will build up in the end. More complex examples would be, a full bathroom or bedroom on the first floor is ideal. Laundry on the main level. Laundry in the basement's hard. So if possible, right, laundry in the main level would be best. Widening doorways so that if we are using our wheelchairs or walkers, we're not banging into things. That would be great. Door handle levers instead of knobs. Levers are much easier to use than knobs. And then entrance without steps. So if possible, so this, I kind of call this like my ultimate wish list. That may not be possible, but it's nice to know it would be good for us. So yeah, if there aren't steps, that would be great as well. So as we're talking about moving things around our house, really trying to conserve our energy, we also are going to do something called grading. So occupational therapists are skilled in what we call grading. So no, we're not like giving you a letter grade. It's not like we're not grading you. Grading just means that we're either increasing or decreasing the performance demand of the task. So as we're analyzing the task, we want to decide how much do we want to change the task in order to meet your needs. So if I were looking at, something like distractions, if you have brain fog and you're tired, distractions are not helpful to you, right? So we're going to want to limit those distractions. Things like object placement. Do I want something near me or far away from me, right? If I'm really tired, I want things near me. So we want to sort of analyze the activities and decide how we want to change the performance demands or the aspects of the activity that is required of us so that we can be more successful. So those are just some ideas. And then my favorite is adaptive equipment. I love it because they're just so useful. Shower chairs. Anyone use a shower chair? Yes. Shower chairs are the best. They are the best. I have one. They're fantastic. So what's really nice about shower chairs is that, again, you can sit. I don't know about you, but when I'm not feeling well and I have that hot water, my blood vessels dilate and I start getting a little dizzy, and I like showering, I want to shower. So I'm going to do whatever I can to adapt it so that I can still do it and it doesn't ruin the rest of my day. Another idea is possibly showering at night so that if you do feel really bad, you can go right to bed. That's just another idea. What we have next to the shower chair is what's called a rocker knife. For those of us with EDS or joint issues, rocker knives are really good because you're not cutting, you're rocking. And when I'm rocking, I'm using my big shoulder muscles. I'm not using my little hand muscles. So that's going to protect our joints. The one after that, and I should have picked a better picture, is a sock aid. Does anyone use a sock aid? So clearly that was a bad picture. I apologize. It is a piece of plastic with strings on the end, and it's curved. You put your sock on it, you stick your foot in it, you pull it up, and you don't have to bend over or reach to put your socks on. It's really, and they're very easy to use. I teach 90-year-olds to use them all the time, and they can do it easily, so they're good. The next one is, have you guys seen these shoelaces? They're like stretchy shoelaces. Those are really, really nice, and they actually have stretchy shoelaces that tie. So if you're like, oh, I want to look like I have tied shoes, great, you can. They're still stretchy. It turns your shoes into slip-on shoes, which is awesome. The next one's a handheld shower. What's nice about that is, I don't know about you, but when I'm sitting on my shower chair, I don't want the water like smacking me in the face, right? But then when I turn around, it's like, okay, but then I kind of can't wash the front of my body because I'm facing away from it. So what the handheld shower does is it just allows bathing to be easier because you control where the water is. And then the last one's a reacher, so that's, or some people call it a grabber. Does anyone have one of those? Yeah, those are great. And a really good idea if you use a walker or a wheelchair is to take a piece of Velcro and put the sticky end on your walker and then put the other sticky end on the reacher so that you can actually stick your reacher to your walker and you can have it with you at all times. That way you're not carrying it around because it's bulky. You don't want to, carry it. So those are just some ways to use adaptive equipment. Those are just highlighting a few. OT has tons and tons of adaptive equipment, so any problem you have, we can find a way to adapt it. We probably have a piece of equipment for it, or if not, we'll figure it out and we'll make something. So we'll move on to some health management strategies with Josh.
All right, so I'm going to go through these health management strategies a little quickly because we do have a little bit more to get through. So I've been doing some mindfulness while I was sitting here and looking at the time. So we're gonna go into this a little bit here. If you've heard of mindfulness before, a lot of people think of meditation. They think it's going to take me 30 minutes of my morning, 30 minutes of my afternoon, and then another 30 in the evening. But that's not the case. Mindfulness can be done quickly, and it can be done anywhere that you want to do it. So we're going to go into that a little bit more. If you go ahead, we'll switch on to the next one. Here are just a few of the different exercises that I found in literature and in reviews. Specifically, self-compassion pause and self-inquiry meditation are super useful, and these can be done in 3 to 5 minutes, or even shorter if you just don't have the time. But it's really just sitting down and kind of like Joanna was saying earlier, I just wanted to, not to quote you, but I'm going to quote you, said sometimes she doesn't know what makes her tired and then she gets exhausted, right? So some of the things you can do with mindfulness is during your self-inquiry, you can say, okay, I just did an activity and all of a sudden I'm just not feeling good. Take a minute, sit down, think about it, close your eyes and think, what did I just do exactly? And you can think back on that activity and live in the moment and be there, and then you can note it and say, okay, now I realize what's making me tired, what's causing this. And so then, going back to how Katie said, you can prioritize and you can think, I can do all of these other things before I start to feel fatigued, right? Because not just tired, we're talking about actual fatigue where we just can't go any further. And so if we do that by applying our prioritization and mindfulness, then we'll be able to kind of organize our days better. And that's what OT is all about. And that's about that health management, is managing that stress of thinking I'm not going to be able to finish my tasks for the day, managing those thoughts of like, oh man, I'm just not going to be able to make it. And in all honesty, those thoughts also cause fatigue, right? So we need to make sure that we're taking time for ourselves, looking inwardly and really focusing on what we can do and knowing that that's okay. We'll go ahead to the next slide. And so part of that is having an attitude, a mindfulness attitude. And so here are some mindfulness attitudes. I didn't put the full definitions up there. I put definitions on the handouts on your tables if you'd like to take those with you. But I'm going to just focus on one specifically, is allowing. And I think allowing is super important because a lot of people think, oh great, now it's time to just give up. I'm going to allow this to happen. Ugh. No, that's not what we're talking about when we say allowing, right? We're saying, okay, let's take 3 minutes. We're going to think, okay, I am just fatigued. I can't do any more. My mind is getting groggy. I can't speak. I need to take a break. And you need to tell yourself that that's okay. We're not getting depressed or sad. It's okay. It's okay to take a break. And you can think back and say, I've done all of these things, and say, I've been somewhat successful today, or I have been successful in this, in this, in this, and focusing on those good things. And the last thing I also listened to during our wonderful PT who presented earlier, she said, you are not broken. And that's so important to remember, especially in mindfulness. You are not broken, and you don't need to be fixed. We just need to take the time to think and inwardly look upon ourselves and use mindfulness to say, okay, I can do this, I can prioritize, I can plan, and I'm going to be successful.
Okay, so we're going to look at ways to explain fatigue management. How many of you heard about the spoons theory? Okay, so a lot of you. So I'm not going to really go into too much detail about it. Basically, the spoons theory is just a tangible way to explain your energy expenditure to individuals that don't actually understand what it's like to be fatigued. Go ahead. So I'm going to spend a little bit more time on this one. Has anyone heard of the energy envelope? No, okay. So the energy envelope is actually extremely interesting, I think. When I was reading articles and doing some research on it, this is what I found, and this is what I'm taking away from it. So everything that you can see on the screen, the physical activity, mental, social, all those things listed are things that you do on a daily basis to complete tasks. That envelope that you have there, that little tiny envelope, is your task that you're going to complete for that day and that time period. So when you think about the the envelope is the amount of energy you have, and everything listed, all those elements on the PowerPoint screen that you see, are things that you do to complete that task. The whole picture of this energy envelope is you don't want to overstuff that envelope to the point where you're fatiguing yourself even more. So the whole takeaway message that I got from it was the more you exert energy than you have available, you're going to intensify your symptoms and make yourself feel worse. And if you live inside your energy envelope, the more energy you have, you'll have more energy to do things, and your symptoms will decrease, and you could possibly expand upon your energy envelope, making it bigger with each time because you're building endurance. So the easiest way that I took from all of that wordage was you don't want to pay double postage when you send this envelope out, so don't overstuff it.
I love that. When Katie came back and told me that, I thought, I don't want to pay double postage. That's great. All right, so the last thing that I really want to touch on, and again, we're just doing a real brief overview, so I would really encourage you to speak to your primary care providers about occupational therapy. One thing we want to study maybe next year is why doctors aren't prescribing it as much as they would maybe physical therapy. We think it's because, just like the majority of you, people don't necessarily understand what it is. They think it's like the other therapy besides PT. They're like, yeah, it's kind of like PT, and we're like, sort of, but we're like sisters or cousins. We're we do some overlap, but lots of things are different. So I would really encourage you, if you're noticing that some of these things may be helpful to you, to really request a script from your doctor to look at maybe getting occupational therapy. So the last thing that we want to talk about in regards to just some self-management strategies for you, because we want you to walk away going, hey, maybe I have some more tools in my pocket, would be joint protection. So those of us that have EDS, this is going to be really important, but even those of us that just have arthritis or pain or discomfort, this is also going to apply to all of you as well. So there are a list of joint protection techniques, and you can look these up online as well and kind of pick out the ones that work best for you. But some of the ones that I pulled up here, the big thing's respecting our pain. If something hurts, especially if we're talking about in our joints, if we're talking about our hands or something, we don't want to keep doing the same thing over and over and over again. That's causing that, right? We want to figure out a different way to do it. We want to make sure that we're using our large, strong joints whenever possible. The smaller joints have smaller muscles, which means that they're going to be maybe a little weaker. So especially in our hands, we want to make sure that we are using our larger muscles. So for example, if I'm going to open a jar, I'm going to, or like this is my Propel this morning. I was drinking my Propel, and I cannot open it like this. Do you know what I'm talking about? I can't put it between my fingers. It's too hard. So I grasp it with my whole hand and I twist it. Because my intrinsic muscles in my hand are going to be stronger than my fingers, right? It's just little ideas like that. Splints, braces can possibly be helpful. We want to make sure we're avoiding positions of deformity. So I don't know about you, but my fellow EDSers, do you ever sit funny or lay funny? And someone looks at you and they're like, that doesn't look right. We want to avoid those positions because although they maybe feel comfortable, they're most likely positions of deformity. So we don't want to allow our bodies to be in inappropriate positions for long periods of time because we don't want to overstretch certain muscles or tighten others. And then some other ones I just want to talk about. avoid prolonged periods of holding the same position. So feel free during this conference to like get up and move if you need to move. If you're twisting to see the screen, like move yourself so you're not twisting, right? So just make sure that you're holding positions that are comfortable for you and you're changing your positions throughout your day. Supportive seating and mattresses. I always laugh at the mattress commercials because they always talk about like, oh, buy this mattress, and I'm like, I just need it to be supportive. I don't care what it is. I just need it to not make my body hurt. If I wake up in the morning and my body hurts, I need to change something about the way I'm sleeping, whether it's my position, my pillows, my mattress, etc. So really investigate and figure out, why are you waking up in pain in the morning? Are you in a bad position? Is it a poor mattress, etc. We want to make sure we're not sitting on stools that don't have backs, things like that. We just want to be protecting our bodies. So that is kind of a wrap. If you guys have more questions or comments, on our handout is my email, so it's contact information, and then we'll be here all day, so feel free just to stop by and ask questions or talk to us, okay? All right, thanks so much, guys.